And so you touched on something really important there in the Mediterranean diet, and this seems to be the most commonly, or the diet with the most amount of evidence in terms of reducing depressive symptoms, right? And there's good quality evidence, like you alluded to, in terms of randomized control trials. For those uninitiated, can you tell us what is the Mediterranean diet? What does that actually look like?
Of course, of course. Well, actually, surprisingly, maybe it's going to be a surprise for some of our listeners, but it's not complicated at all. If I ask you to give me an example of a healthy diet, you probably come up with a very similar diet to the Mediterranean diet, actually. So the Mediterranean diet, it was primarily suggested to be used in the treatment of cardiovascular disorders. It was a study called Seven Countries, developed by Ansel Keys in the 19th. So basically, the diet is composed by a higher amount of fruits and vegetables, and it has olive oil as the primary oil. So all of these food components, they are very rich in vitamins, minerals, and also polyphenols, antioxidants, and anti-inflammatory polyphenols. And there is also a higher amount of whole foods, which is source of fiber. And we know that fiber has a important impact in our gut microbiota, for example. So we have this prebiotic action of this nutrient. And it is actually low in red meat. So the main source of protein is fish and legumes, and low in ultra processed food. So this is maybe one very important characteristic of the Mediterranean diet, because the ultra processed food, we have an increasing number of evidences showing the negative effect, the negative impact of ultra processed food, not only for our metabolism, but also for our mental health. There was one study published in last year, September 2023, that showed, for example, that individuals who eat more than 8 servings of ultra processed food a day have 50% higher chance to develop depression than those who eat 4 or less servings a day. So this data also highlights that, the ultra-processed food is not only associated with metabolic disorders like obesity or obesity-related metabolic disorders, but it is also related to our mental health, right? And and the consumption, the consumption of this ultra processed food, this type of food, is increasing globally. It is already the main source of calories in many high income countries. So we need to pay attention on that. We need to be aware of the impact, the negative impact of ultra processed food in our health, in our mental health. And we need to encourage people to decrease the consumption, or decrease the amount of ultra processed food that they eat. And maybe one thing that just popping up in my mind, maybe the listeners are not very familiar with what ultra processed food is. I
Yeah.
don't know if you know
Yes. No,
how to
please tell us. Yeah.
classify
Yeah.
it, right? How
Yeah.
to choose the correct food for us. So ultra processed food is basically, so first of all, they usually comes in packages. And when we read the list of ingredients, we are going to find some ingredients that are not common ingredients present in our kitchen. So they are not culinary ingredients, such as sugar, oil, or salt. We are going to find the list of ingredients. We are going to find some ingredients that we have never heard about. So this is a very simple way to classify ultra processed food. Of course, we have like a better classifications or better way to identify. But for the general public, I think it's a easier way to explain, and we can really choose our food based on this classification. We should avoid this type of food, basically. Yeah. So this is the composition of the diet, more or less.
Yeah, and I think that's a really important point about breaking down what ultra processed food are, because when I was reading for this discussion, I always thought ultra processed food was like just McDonald's and KFC. But looking through, I think it's the Novo classification of
Exactly.
yeah, processed foods. I didn't realize that things like 2 minute noodles are ultra processed food. So I went and threw out my packet of 2 minute noodles that I have in the cupboard. So yeah, it's interesting to note that foods that we think perhaps are less processed actually fall under the ultra processed kind of banner. So I'll put a link in the show notes for people who want to check out that classification list.
Yes, it's super interesting classification. Was developed by Carlos Monteiro, a Brazilian researcher. So yeah, from my motherland, and yes, and they have his research group has a lot of studies showing the negative effects, the negative impact of this type of food. And the Nova classification helps us to really classify and trying to track, like, I mean, like when we can classify, we can also can evaluate the impact of it, basically, right? And then, yeah, in the mental health, I mean, like it's a more and more papers are coming out showing the negative impact of it in mental health. So we need to be aware of it as well. Yeah.
The SMILES trial that you alluded to, as I understand it, the symptom decrease that you saw was independent of weight, right? So this is not about losing weight as such. This is more of a direct effect of the Mediterranean diet, independent of any weight changes. Is that right?
Yes, it is right. It is right. It's a very good point, indeed. That in this trial, people did not change the weight, and they had the improvement in the depressive symptoms. However, there is one meta-analysis that have shown that for example, for people that underwent nutritional intervention to lose weight. So, for example, patients with obesity, when they were they lose weight, when they actually lose, they were successfully to lose weight. They also had a better improvement in the depressive symptoms. We know that there is the bidirectional connection between obesity and psychiatric disorders in general. And probably inflammation is one mechanism that underline this connection, because we know that obesity it is accompanied by chronic low-grade inflammation. So people with obesity have also a higher level of inflammatory biomarkers, and the same for psychiatric patients with psychiatric disorders. So, for example, patients with depression, they also have a higher level of inflammatory biomarkers in the blood. So we have these common mechanisms that underline probably the connection between these two disorders, right? These two diseases, and then, but independently of that, we can have the benefit. So if you are in a nutritional intervention that aims to lose weight or to regulate the metabolic complications that you have, for example, and in parallel, you measure also the depressive symptoms, so you might have benefits on decreasing the weight. That's what I'm trying to say. But in the SMILES trial, they showed that it's not mandatory for all the patients. So if they are in a good metabolic condition, well, probably the diet itself will help, because we have a lot of dietary components that can be anti-inflammatory or antioxidant independently of the change in weight, you know. So yeah, so it's not like mandatory, but if you are in the nutritional approach to reduce weight or to lose weight, well, we can have benefits on your mental health if you achieve the goal of the treatment,